Have you ever seen a chalazion that just won't go away, especially in an elderly patient? Well, it might not be just a simple bump. It could be something far more serious. Sebaceous gland carcinoma. Sebaceous gland carcinoma is a rare but aggressive malignant tumor that arises from sebaceous glands, most commonly in the eyelid. And although it's uncommon, it's considered one of the most dangerous eyelid cancers. Why? Because of its high risk of local invasion, recurrence, and metastasis. It usually originates from the meibomian glands in the upper eyelid's tarsal plate, and less commonly from the glands of Zeiss or other sebaceous glands in the skin of the head and neck. This cancer tends to affect elderly individuals, especially females, and it's seen more often in Asian populations. Clinically, how does it present? There are two common patterns. It may appear as a firm, painless nodule resembling a stubborn chalazion, or it may cause diffuse eyelid thickening with features like matarosis, lid margin distortion, or even conjunctival involvement. And here's something unique about it: pagetoid spread. This means the tumor cells spread within the conjunctival or skin epithelium. It can mimic chronic conjunctivitis, which is why sebaceous gland carcinoma is often called the Great Masquerader. So, any recurrent chalazion in an elderly patient or unilateral chronic blepharitis should raise red flags for SGC. But diagnosing it isn't always easy. It mimics common conditions like a persistent chalazion or chronic conjunctivitis, so clinical suspicion is essential. If there's any doubt, always biopsy. Start with a full-thickness eyelid biopsy with margin control. If there's conjunctival involvement, do a map biopsy. Imprint cytology can help confirm the diagnosis. The tumor cells typically show vacuolated cytoplasm and stain positive with oil red O. If deeper invasion or metastasis is suspected, request an orbital CT or MRI. Metastasis can occur to the lymph nodes, lungs, liver, and brain. Treatment: the mainstay for localized disease is wide surgical excision with margin control, often using frozen section or Mohs micrographic surgery. If there's pagetoid spread, cryotherapy or topical mitomycin C may be required. In advanced cases, treatment may include orbital exoneration or radiotherapy. What about prognosis? Sebaceous gland carcinoma has a recurrence rate of up to 30%, especially if not fully excised or if pagetoid spread is missed. Early detection is key. Prognosis depends on the tumor size, how early it's diagnosed, and the extent of local or distant spread. That's why long-term follow-up is essential.